Well, Kim Kardashian recently revealed that she has been diagnosed with lupus on the season 17 premiere of her reality series, Keeping Up with the Kardashians.
Yeah, though she has ignited conversation, many celebrities and people have been living with this misunderstood autoimmune disease for years. And joining us now is lupus expert Dr. Tiffany Caplan to shed some light and break down just what people with this disease will face and how to achieve remission. Thanks for coming in all the way from Ventura. So I think everybody's heard of lupus. They're just not quite sure how you get it and what it is and what are the signs.
And actually, one of the crazy statistics that I learned about lupus when I really first started looking into this after a family member was diagnosed is that the highest risk population is actually women ages like 18 to 34, the childbearing ages, and 90% or about maybe 2/3 at least of that population had never heard of lupus or didn't know anything besides the name of lupus. And so lupus is an autoimmune disease, meaning your immune system actually attacks different parts of your body, different tissues and organ systems. And so lupus is actually systemic. It can cause multiple different areas of destruction in the body, leading to serious complications, sometimes even death.
And a lot of times it includes flare-ups, right? And what aspect, like on the skin or inside?
Yeah, so depending on what part of the body is actually being attacked, so somebody can have skin rashes, the butterfly rash across their face. Somebody can have just a lot of pain, joint fatigue, or joint pain, systemic issues like kidney failure, all of those things. So when they're in a flare-up and their immune system is actually getting worse or overactivated, those are the types of things that they'll notice.
Diet plays a big part in a lot of things that we've learned now. You say there's 5 foods that you need to avoid?
Yes, and now there's no magic diet for lupus, but we know that there's common foods that cause problems for people. So we know that gluten-containing grains are very inflammatory, so is dairy, of course sugar, soy, and corn. So those are some of the biggest foods that we see across the board people reacting to.
And you also, you were saying just now that you have a personal experience with someone who has lupus. How are they dealing with it?
Yes, and so that was actually, they first got told they had lupus, and then the doctor kind of backed up and said, no, maybe you just have fibromyalgia, some arthritis, and that's actually really common, is people, it actually takes on average 7 years of somebody having symptoms to get the correct diagnosis. So there was a long time where they were suffering with multiple different issues and symptoms and not really getting the clear diagnosis. So now we're really helping kind of clear it up because we help people actually achieve remission in our practice.
So you and your husband, actually, you've written a book about this now.
Yes. We wrote a book. It's called The Lupus Solution. It's actually coming out in a couple weeks. And it's really just to help people understand what lupus is and how to avoid the flare-ups and also how to achieve remission, because we know it's possible and we do help people with that.
Oh, so it is completely, you can go into remission with it?
You can completely go into remission, absolutely.
Mainly diet?
That's a huge part of it, but there's other lifestyle factors. It could be things in your environment that are causing issues. Stress is actually a big player in that as well.
Interesting.
So just learning what the person reacts to.
Well, I got to admit, I think I know 90% more about lupus than I did 5 minutes ago.
Yes, exactly. Well, thank you so much.
Well, thank you for having us. We need this information out there, and you can find out more at our website, KaplanHealthInstitute.com.
All right, for more information, you can head over, as she said, to KaplanHealthInstitute.com. Dr. Caplan, again, thanks for coming in.
Thank you for having us.